Hi, this is the International Association of Minority Vets news podcast. Today we have a very special guest. He works at
CCNC,
CCNC. How about that? Can you tell us what that is?
Coastal Carolina Neuropsychiatric Center.
Okay, tell us what your credentials are.
I am currently a licensed clinical social work associate, or otherwise for short LCSWA, and I've been working over at CCNC for 4 years. Started out with my BSW at UNCW and my MSW at USC, not the one in South Carolina, University of Southern California.
Okay, tell us about your military career.
I joined the Marine Corps in 1994. I was what we call a walk-in. I wasn't recruited, so I volunteered. I walked in. I knew what I wanted. My primary MOS was motor transport, motor T. I was a 35-33 LVS operator, and once I became staff NCO, then I became motor T chief.
Okay.
Spent most of my time at Lejeune, but I did do 3 years in Okinawa, Afghanistan in 2009, and the MEU, I think, in 2000.
Okay. Well, that's good. Tell us how you decided in the Marine Corps. How did you decide to move into counseling?
Well, besides my primary MOS, a lot of my side billets in the Marine Corps, I realized fell into the social work realm, starting with the SACO position, substance abuse control officer, family readiness officer, the family advocacy program, which I think a lot of Marines haven't heard of and don't know about, because it deals, one of the programs that deals with child abuse, spouse abuse, neglect, and those things. So it's a collaboration of outside agencies, law enforcement, child protective services. It's kind of that side of the Marine Corps military, because all branches have it. It's just dealing with the bad stuff that happens to families and kids and that nature.
Okay. Well, what kind of bad stuff did the family, just to educate people about the family advocacy?
So when there's like reports of abuse, all of that, they bring in law enforcement, military personnel, and doing assessments to see, whether things are substantiated or not, which, I would say is not for the lighthearted, because you got to look at these photos.
Oh, okay.
And so that's kind of that proof and that evidence of how things get substantiated, is not just taking word for word, but looking at photos, and some of that stuff can be hard to look at.
I can imagine.
And then constant back and forth to the counseling center to help Marines, help their families. And so I became the go-to person in the unit to be able to help Marines because of that, and then some of the training that I had to go through with abuse and drug use and understanding spousal abuse, child abuse. And so it's, doing all of that in addition to, mentoring programs. When I did my assessment as I was getting out of the Marine Corps, it's just kind of one of those things that kind of was my strong suit of being of service.
Okay.
And so, not to mention, I didn't want to do anything with math, so
Yeah.
going into the social work field, I didn't have to do a whole lot, but it felt right.
Okay.
And I enjoyed doing it.
All right. So we talked about the family advocacy. Tell us what you're doing now in the community, about where you're working.
So I'm over at, like I said, CCNC. Easy to say that than the full name.
Yeah, of course.
And so right now I work with children's, teens, adults, families, and I'm big on what we call CBT, cognitive behavioral therapy. Also solution-focused brief therapy, but I really love the cognitive behavioral therapy because a lot of what we experience and what, individuals I work with is just a lot of times if we think about it, if it's in our head, we think it's real. And so, like I try to tell a lot of individuals, if we kind of put our thoughts on trial, and if there's no evidence, then it can't be true. And so working with families and children, occasionally couples, it's being able to help them understand and break the stigmas, because there's a lot of stigmas about mental health, especially amongst our youth, because I think a lot of people see if you go to therapy or seeing a therapist, they associate it with the insane asylums of psychiatrics.
Yeah.
And it's like, I jokingly tell patients, well, there are no padded rooms. Mr. Roberts' room is not padded. And I can't do that kind of treatment anyway.
Yeah,
But,
there's a big stigmatism when it comes to mental treatment. People who seek out mental treatment, people think that they're loopy or whatever. But tell us about the importance of the getting treatment.
well, the treatment is one of those, if first you got to want it. It doesn't matter how many times a person tell you or make the recommendation, that person has to want it. And sometimes I think not sometimes, but a lot of times when you think it's just you against the world, that's a no-win situation. Mm-hmm. And so that mindset kind of leads into other things. But if you just know there's one other person that's with you, now it's two of you, you still don't have a chance against the world, but you don't feel so bad because you're not alone. And as you continue to go through that cycle and understand, we do realize that there are other people that are dealing with these things.
Right. Well, how can you tell? How can a person tell? Maybe they've never been diagnosed. How can they tell that they may need help? Or how do you tell somebody that they need help?
So the main things, anxiety and depression, there are screening sheets. If you've been for a lot of veterans in active duty, if you've gone to the BAS or Naval Medical Center, you've done a screening sheet for anxiety and depression.
Okay.
Those are kind of some of the quick, that's become the common thing. If you're noticing things about yourself that don't seem right, like depression, there's a difference than if you just want to take a day off and don't do anything.
Right.
Versus you're taking a day off and then 2 days, then 3 days.
Right.
Not communicating, isolating yourself, not showering, not eating properly, just secluded, cut off from the world. Mm-hmm. That's not normal. Mm-hmm. And that's why I do that comparison, because a lot of times, I didn't do anything all day, is that a problem? No. Mm-hmm. We all need a day that we just don't want to do anything. But when that day turns into 2 days and 3 days, and a lot of times it's individuals that point it out to us.
Right.
It's
a
like,
lot of times.
You've been stuck in the house for 2-3 days. No, I haven't. Today's Tuesday. No, today's Friday.
So let's say a person does, let's say 2 or 3 days, 4 days, 5 days, they just are out of it. How would a family member, convince them? Because a lot of times people who have mental illness, they don't want to face the fact that they have mental illness, or they feel like, okay, I'm going to have to take all this medicine. I don't want to. Or am I going to take this the rest of my life? How do you talk to a person like that?
Well, me personally, I don't do medicine.
Right.
I do recommend it at times, but that's not the first go-to.
Oh, and right.
I think that's a big thing that keeps a lot of people from wanting to go get help.
It does.
Because unfortunately, that is some of the things, the recommendations that are made. But psychotherapy, which is, clinical therapy, it's helping you learn coping skills and strategies to deal with it on your own. Granted, there are times that medication may be needed, but I tend to recommend medication and therapy.
Okay.
Not just medication alone.
Right.
One of the comparisons I do having been in the Marine Corps, we all know about the Motrin. You know, you get 800 milligram Motrin right off the bat.
Yeah.
But if you get used to 800 milligrams, then I need something even stronger.
Right.
And then I get used to that, I need something stronger.
Stronger. Right.
And so a lot of us don't want medication because we don't want to get hooked on it. And so that keeps us from going. So learning that you can get therapy and learn coping skills and strategies and other ways and breathing techniques and mindfulness and meditation of ways of helping us cope with things.
Well, let's talk more about that. What kind of coping skills should a person develop? Let's say depression. What should they do? How should they cope with that?
Well, first we got, I would say, being able to talk to someone. Don't isolate yourself. Helping, using your
Coping skills?
not the coping, but using your surroundings, your network, the people that are around you, to help you. Don't try to go it alone. And I know that can be hard for individuals that do live alone. So, having, your environment is very important.
So would you say a person that has suffering from depression, would you say they need to structure things to do every day?
Yes. A lot of times I suggest, you have the thought that you want to go for a walk, then just do it. Don't think about it, just do it. Even I had a former coworker she was sharing with me that one study states that, our shoes makes a big difference.
You know what? I've heard that too.
Because if you think about it, you can get dressed, but you still don't leave the house until you put your shoes on.
Yeah.
But once you put your shoes on, it's like something triggers in the brain that, okay, I got something to do. And so, I would say that's kind of like how cognitive behavioral therapy works, is that you got something to do, but until you put those shoes on, it doesn't register in our heads that I got something to do. And so when we're dealing with things like depression and anxiety, a big part of that is being able to talk about it freely.
Yeah, I'm pretty sure that, yeah. Because like we were speaking about counseling, being honest and everything like that, to be able to get help, to be helped effectively.
Yes, it's a lot of times people say it doesn't work. And my question then would be, were you honest? And did you actually try the coping skills and strategies that were recommended? I tend to say one of the simplest but most effective coping skill is the deep breathing. Okay. But a lot of times, because it seems simple,
yeah,
it's like no, I don't see how that works.
Right.
But as someone that scuba dives, learning to control your breathing is very important. Mm-hmm. And so when I connected the two of those things together, what I did when I scuba dive and deep breathing, it's the same thing. Because if you learn to control your breathing when you're underwater, you have more air in your tank.
Okay.
Or if you just go through it rapidly, you can see the needle move. So the deep breathing does work. It's just, but it's one of those things we do a lot. Yeah. We just don't exaggerate it. So when people's like, okay, I took a deep breath. No, it's, just exaggerate it. So it's like.
Now, what does that do for you? What does that do?
It relaxes you. When you control your breathing, if you're focused on the breathing, you're not focused on the problem.
Oh, that's true. I didn't think about it like that.
And so when you can, allowing yourself to just focus, we still get thoughts that come in our mind because you can't control that. That's kind of what we call intrusive memories and thoughts. Yeah. You can't control that, so don't focus on it. When you just focus on the breathing, then you're feeling the air enter and exhale. I tend to tell patients the exhale should be as long as you can breathe out, slowly, not too fast.
Okay.
So some of the sheets say you breathe in for 4 seconds, hold it for 4 seconds, exhale for 6. As long as you can exhale, then that's doing that. So you can do that 60 seconds, 120 seconds, or whatever, and that can help calm you down. But then,
Yeah, I mean, it's a person who deals with anger issues. Wouldn't that be a good exercise for
Yes.
them? Okay. Let's talk about drug abuse. We were talking because that's one of your things that you're skilled at. You've been trained in that area.
in the Marine Corps, I did the substance abuse control officer.
Well, let's talk about some of the things in the Marine Corps about. How about the substance abuse? What's the stats on that?
The stats as far as the abuse,
Yeah.
with one of the recent studies that was done by the American Addiction Center, which was reviewed by Dr. Hansen, is that if the veteran or the service member is using alcohol or drugs as a coping skill, you're kind of teaching your family how to deal with that. But then that use of drugs and alcohol leads into child abuse, spouse abuse, neglect, spending up your finances.
And that's where the advocacy family people come
Yes.
in. And, okay.
And that both of those kind of go hand in hand, because with being the SACO, when Marines or sailors test positive on the urinalysis, then we try to get them over to SARP, which SARP is the Substance Abuse Rehabilitation Program. And so that's kind of mandatory that they go through that program, and trying to help them overcome that. But drugs.
Well, when you say that's the indication of something wrong with them, like something that they need, fixed
Yes.
emotionally or.
But a lot of times, people don't realize, service members don't realize that they binge drink.
Oh.
Binge drinking is when you have 4 to 5 drinks in one setting, which unfortunately is all too common.
Yeah.
Having been in the military, you notice that
Of course, Marines, people in the Army, we don't suffer from that.
when if you look at the end of most field exercises, or you come back from deployments, or just on the weekend, if you're over at the exchange or, one of the, stores, it's evidence.
Yeah.
You see the Marines coming out. And so,
Well, what would you suggest they do if they, to entertain themselves? Because drinking is a big deal in the military. We do a lot of drinking,
Mm-hmm.
So, what would you suggest to a Marine that might be having a drinking problem, or any service member for that?
if you're having a drinking problem, like I had one of my frat brothers who was in Afghanistan with me. He got out of the Marine Corps, went back to school, joined the Navy as an officer. One of his jobs was substance abuse. And so in having that actual training with the Marines before we came back, of understanding what binge drinking is, how, that connection to family, to where you may have had a parent or grandparent that was also drinking, or what we know today as alcoholic. It kind of makes you a bit more prone to drinking more than somebody else. And so a lot of times service members don't think they have a problem.
Right.
It's, I can still do this and do that. And it's what, some call where you're just a functioning alcoholic, to where you wake up in the morning and you can't start your day until you have a sip, and then now you're ready to go. It's just having other alternatives for service members to be engaged in, and individuals caring more. And I'm not saying that they don't care, but we need to be more engaged, or they need to be more engaged to help them find alternatives to drinking.
Yeah.
And providing more activities and other events so that they can learn that you can function. You don't have to have alcohol to have fun.
Right. Yeah. Okay. So, solutions. Part of the solutions you say is having things to do. Tell us now. You're involved in a barbershop talk. Tell us what that is and how it came about.
So the barbershop talk actually came about. I did a mental health workshop in Wilmington. One of my sorors from Zeta Phi Beta Sorority Incorporated asked me if I would take part in it. And so it was actually the day before that Friday, I was actually at the barbershop and saw one of my frat brothers, Brother Pastor Jones over at Marshall Chapel Church. And he's like, man, you need to do something like that here. And standing in the barbershop, it's like, oh, this would be the perfect place for it. So I thought about it, talked to, my boss at home.
Yeah.
And she said, go for it. So,
Right.
so it's something that I took from the workshop that I did in January to where it was said, we need to do more of these. We need to have more.
So what do you do at the barbershop talk?
So the barbershop talk, this is the Black Men's Mental Health Series. So because there is a stigma amongst African American men and men of color about mental health. And so the barbershop talk is providing a safe place for where we can discuss and educate about mental health and how it affects us. The first one is going to be at Headquarters Barbershop on the 24th from 6 to 8. And I have Mike Houston, who's a member of Alpha Phi Alpha Sorority Incorporated. He's going to be joining me, and we're going to tie in how the socialization of man also affects our mental health. Because I always say, for men, we've kind of been hoodwinked to think you're not supposed to show emotions, you're not supposed to cry, you got to be rough and tough, and we're passing that on to the next generation. A lot of fathers have never said out loud to their sons, I love you, have never hugged them, kissed them on the cheek, because you're not supposed to do that.
Right.
And so there's a lot of trauma that we suffer, but then we join the military. And speaking from my experience as a Marine, well, once a Marine, always a Marine.
Yeah, that's what they say.
The military can mask trauma,
Yes.
like anger. And anger, I always say, is a secondary emotion. There's something that's causing it, the why. But the military can mask that because it's an environment where you can be angry and nobody's going to really question it.
Right.
But then you're adding more trauma, especially if you've been in a combat environment. And so once we leave the military, there isn't a lot of guidance and education on what to do and how to deal with it. And we hide it. Me personally, when I was getting mental health treatment, I didn't tell the command.
Right.
I had problems with my knees, so everything, I had a medical appointment. But I was actually going to see a therapist.
Were you afraid that you were going to get lying was going to get you in trouble?
Yes.
Okay, so that was something you was dealing with too.
But the thing is, I had to early on register my daughter with the, I can't think of it right now.
Okay.
But there's the program where, if your child has, she was class 4 asthmatic.
Okay.
And so when I signed her up, there was a lot of feedback from the command about what I would be able to do and couldn't do. And so when I came back from Afghanistan, I didn't want them to know what I was going through.
Yeah.
So I just, because like I said, I had the problems with my knees, I used that as my excuse, because I
To go
went
to
out
your
of town.
sessions.
I did initially try to go through the base, but at the time it was like a 45-day wait. I couldn't wait 45 days because
Okay.
I had already kind of snapped and went off.
Yeah.
Everybody in the house, my youngest son, I think at the time was 3 years old. And so I just jumped in my truck and just started driving.
Yeah.
And then I realized it wasn't them. The mindset is that we don't have the problem. It's not me, it's everybody else.
Right.
And a lot of veterans aren't lucky to come to that realization. I tell a lot of the men, especially if they're veterans, but men in general, we're not going to therapy just because we came to that realization ourselves. A lot of us, the majority of us, are in therapy because we got an ultimatum.
Oh yeah.
And
Yeah.
it's easy for me to be upset at you for talking about therapy, but I'm not really upset at you. I'm upset at myself that I'm not admitting that there's a problem, and I don't want you telling me what I already know, but I'm just strong enough to admit it.
Okay.
And so seeking, trying to get that help before that point is hard, because men are told we're supposed to be a certain way. And you can't be a man's man, then you join the military, then you go to a combat environment, you're king of the hill. You can't tell nobody you got problems.
Well, tell me this. Do you find that in these talks y'all have camaraderie and that y'all helping each other?
Yes.
How important is that?
Like the workshop that was done in Wilmington last month, as things went on, it became more, of a, understanding, because like I said, I'm big on the psychoeducation. And so, as a member of Phi Beta Sigma Fraternity Incorporated, that's one of our initiatives is mental health, to bring more awareness to mental health. Mm-hmm. So when you're in an area to where you start talking and you hear other people talk, then you realize you're not alone. There are other people that are like me. And we try, with the barbershop talk, it's something that I'm trying to do every month at a different barbershop.
Okay.
Because even in this town, there are a lot of barbershops. So if the first one I'm doing at headquarters, if you're in this area and that's where you go, that's
right.
Great. But then if you're on the other side of town, you don't come over there to headquarters or by the mall. You go to the barbershop there. So by trying to do it in different locations, I'm trying to provide more exposure to places, to the barbershop being a place that we can just sit and talk and feel comfortable. It's going to be, in person. It's not going to be, recorded or Zoom or anything. Mm-hmm. But giving individuals an opportunity to talk. And the psychoeducation piece is that if you went to the doctor and they said, okay, you got high blood pressure or, cholesterol is high. In most cases, they almost immediately send a note over to the nutritionist. And when you leave his or her office, you go talk to a nutritionist. But when it comes to some of the mental health stuff, mm-hmm. we don't get to go and talk to anyone. I've had a lot of parents, ask, what is ADHD? What is anxiety? What's depression? Mm-hmm. Struggling to understand autism, because some of individuals, and mostly in my experience, have been fathers that think some of these mental health diagnoses are going to go away. They're not going away. A lot of people say, well, I got rid of my anxiety and it came back. No, you didn't. Anxiety is a part of all of us. You can't get rid of it. Mm-hmm.
Is it like an emotion?
It's that feeling, yes, of being overwhelmed. So the best way I just recently been able to connect it is that there are athletes, professional performers, everybody have their pre-game ritual or their pre-performance thing that they do. And I say, I don't care what you call it, you're doing what you got to do to minimize your anxiety before you step on the field, before you step on the court, before you step on the stage. And that's okay, because you learn to control it. Another comparison would be if you ever been to an amusement park and you're going on a roller coaster.
Yeah.
your stomach, everything just starts to, that's anxiety.
Go
that's
haywire.
That feeling of being overwhelmed.
Okay.
But you get on that ride anyway. And for some of us, you get off that ride and you go right back and get in line.
Yeah, I'm one of those.
Because you've learned to manage that anxiety. And it's not always anxiety from something that's bad. It's just that feeling of being overwhelmed and you don't know how to control it. You don't know the coping skills. And so it can get out of control.
Well, a lot of service members suffer from anxiety. So what are some of the things that they can do?
getting help.
Yeah.
Is the first one.
The first one, yeah.
And just being honest. You know, if you're going to seek therapy, be honest with your therapist. A lot of us say interview your therapist because not every therapist is going to be a right fit for you. But when you do find one, be honest and don't be ashamed because anxiety and depression, they're also part of PTSD. And so understanding this and knowing what to look for allow us to be better educated. And now I know what I'm working with.
Okay, well let's put a pin in that. What do we look for? If you're depressed, what kind of things should you be experiencing?
Well,
for depression, let's start there.
And we covered that before. Is isolation.
Okay, yeah, we did.
You kind of, cut yourself off from everybody. You just stuck in your room, not eating, not showering. Don't want to communicate with anybody. The anxiety, it's just feeling overwhelmed. Rapid breathing, your heart rate is like a lot of people describe it like having a heart attack.
Yeah, being overly excited. Like
I've even had some tell me they get nauseous. Vertigo is like everything spinning around, loss of direction. Everybody is not going to experience the same thing.
How do you treat something like that?
Through cognitive behavioral therapy, psychotherapy, which is seeing a therapist, and medication or a combination of both.
Okay.
Like I said before, medication can help. A lot of times when I do recommend medication, it's because the patient and I both are trying to struggle with what are the triggers to that anxiety.
Okay.
And so when you're having, when they're having those issues constantly, maybe medication can kind of help until we can kind of pinpoint it. But the triggers are very important, just like with PTSD. You got to know what your triggers are.
Right.
Just because you're in therapy doesn't mean you're not going to have any more triggers.
Okay, and some people might not know what a trigger is.
So when you got a lot of vets that, noise. So I always joke, you join the military, and if you end up going to combat, they don't tell you how that screws up the 4th of July for you.
Oh, yeah. Okay.
Because
I have heard a person say that.
You're not used to that. It's not the same because a lot of these fireworks don't sound like fireworks of old.
Right.
And then certain sounds, helicopters flying over, familiarity with certain, when you're driving around and you see something. I always say one of the quickest triggers that we don't get a warning for is the sense of smell.
Oh, yeah. That kind of come on you.
Yes. You can be driving somewhere, it's like, man, this reminds me of something, and then it hits you, oh, this reminds me of that. But with the sense of smell, it goes straight to the brain.
Wow.
And so triggers are things that are going to set you off. And the more you understand it and the more you use the coping skills,
you can look for it.
You can look for it. I will say this, it does not mean you won't go from 0 to 100.
Okay.
Okay? That's going to happen because it's quick. But now you're able to recognize. So
can you take it down a notch?
Right. So
okay.
Using myself, for example, before I started going to therapy, I hit that 100 mark and I'm up here 2-3 days.
Yeah.
Nobody don't want to be around me because I'm just 100% just going and I'm, all those symptoms, anger, frustration, and it can't be around anybody. And so over time, those things still happen, but instead of being up here for 2 or 3 days, it might be 1 day, and then it might be 12 hours, then it might be 2 hours. So the more you understand and use the coping skills, you're not up here for a long time. But a lot of times we're told you got to get used to your new normal. What is the new normal? We hear it a lot, but we don't really understand what that is.
Right.
And so my way of explaining it, because of trauma, the average, typically we don't see a lot of trauma, depending on what your job is, you know. So you may, you know, experience something. So you go from 0 to 100 and you're able to get back down to 0. But for veterans, you know, active duty members, first responders, that trauma happens often. And so it gets to the point you don't hit 0. 0 then becomes 5. 5 becomes 10. 10 becomes 20. And so 20 then becomes your new normal.
Okay.
Because you never get back to 0 because you're always on edge. And so if you notice, you know, if you had certain individuals when they go in a restaurant, they got to sit, they got to look
Sit
for
a
all the
certain place,
exits,
yeah.
yes. Or you just can't be in certain environments.
Yeah, because I know a family member that suffers from anxiety. They really don't want to go around a crowd. And you can't convince them to, you know?
It's that way of thinking, everybody's looking at me, is something wrong with me, and that anxiety, that feeling. One of the things with that, you know, exposure therapy is getting yourself used to it. Since being in this profession, Walmart is a trigger for a lot of people.
Oh, God.
And so you know, sometimes it's like, you know, but you got to go to the store.
Yeah.
Regardless of what store it is. So if you get used to doing it at a little bit at a time, going there when you don't have to. Because if you wait until you have to, your
It's
anxiety.
a little bit more anxiety.
Yes. And so
Okay.
kind of like just walk into Walmart and just kind of walk around for maybe 10, 15 minutes and leave. It's building an exposure to, if it takes you 40 minutes to do your shopping, you want to build up that exposure to maybe you can be in there an hour.
Okay.
To where you know you can go in, get what you got to go, and get out. We don't really talk to people when we go shopping.
Yeah.
We go and do what we got to do and get out. But if you're focused on all the cars in the parking lot, Walmart's a big store.
Yeah.
So all the cars you see, and it's not like everybody's standing
Crowded
in one
up,
spot,
yeah.
you know, except for Black Friday. And I think that too kind of puts an image in people's head. And again, cognitive behavioral therapy, if you're thinking that image, that's what it's going to be like every time you go into
Every
Walmart,
time. Yeah.
then you're never
So a
going to do
man
it.
thinks, so is he.
Yeah, so that exposure therapy gets you a little bit used to it. And medication helps. But medication does not get rid of the underlying cause.
To understand the thinking and all that has to be conditioned.
Yes. So
Okay.
what I mean by that is if you're afraid of heights and you get medication, now you can walk over a 100-foot bridge. What did the medication change? Because the bridge is still 100 feet.
Mm-hmm.
It just kind of helped you, but it shouldn't be the first thing you go to. Sometimes I hear, oh, I need my medication before I can do this, or I need my medication before I can do that. That, to me, kind of puts you on the track of being dependent on that medication, and you're
Right.
not trying yourself.
Right. And a lot of people are addicted to drugs nowadays. If there is a way to overcome, you have to have a willing social worker that's willing to explore that, you know. And I don't want to get into the money that drug companies make, but yeah, it's good to have an alternative. And then if you have to have medicine,
Right. You know, excuse me, using your coping skills allows us, because nobody's perfect. You're going to miss a day or two.
yeah,
But because of those coping skills you learn, hey, I made it through the day. I forgot to take my meds. It wasn't that bad. That could be the sign of learning to minimize, you know, how much medication you take. Because again, you get used to 5 milligrams, then you got to go up to 10. Then it keeps going up, but you're not doing anything on your own. And a lot of us don't want medication.
right.
So you know, the psychotherapy, the coping skills and strategies are helping us learn to do those different things.
Okay. Well, I want to tell everybody again before we close how they can get involved in a barbershop talk. I feel like a lot of people, like you said, who are not maybe going to see a therapist or whatever, little things like this can help educate them and maybe push them in that direction that if they're needed.
Okay, so I'll post it again on my Facebook page.
Well, tell everybody what your Facebook page. Are you going to tell people where the barbershop talks are going to be?
This month is going to be at Headquarters Barbershop.
Okay.
I don't know the exact address, but I know it's across the street from the mall, in the same shopping area where Rita's Italian Ice is.
Okay.
Jeff Barrett is the owner, and that's going to be the 24th from 6 to 8. I don't know what my actual Facebook account is,
Yeah.
but
I'll get it from you. Maybe post it up on the screen so everybody can see.
yes, and there's a barcode on there. All you got to do is scan the barcode. It'll take you to the registration link, and you just fill that in, and it's done. The reason that we're having individuals register because not every barbershop is the same size.
Right.
So, I don't want those that are volunteering their shops, I don't want them to go over their, fire code of how many people.
Overcrowding, right.
So we're, space is limited, but some barbershops are bigger. So when we do the one next month, flyers will be posted at the beginning of each month, and you just go in and register. And so, like I say, the intent is to do this every month at a different location and bringing in different individuals so that I'm not the only one up
Talking,
there
right.
that you're seeing. It's called the Black Men's Mental Health Series because I think as African American men and men of color, we really struggle with mental health because of our background, our family dynamics, our culture. That we're supposed to keep everything in house, or not even supposed to talk about it outside the house, let alone you can't talk about it in the house. And one of the joking things, but not necessarily a joke, is when I tell people now, as an adult, we can all think back to that one family member that we now know had mental health, but back then, we didn't call it.
Well, actually, and I'm sure you know this, it's just been a few years that people have identified certain illnesses in mental health and know how to treat them. Because I know I have another family member, I say I'm 53, so I'll say 60 years ago, they really didn't know what bipolar was.
Right.
They knew what, how a person acted, but they didn't really know what it is, and they just defined it when, I don't know. But it hasn't been that many years.
And so that's the thing of understanding. And I tend to tell patients, don't get hooked up on the diagnosis, because you'll drive yourself insane. And the internet is so full of, I looked this up and I think I have this and have that. And a lot of times all the diagnoses have some similarities. So I might have this, talk to the professionals, talk to your doctors, and get started. The purpose of the Black Men's Mental Health Series is so that we become familiar, because it is a big stigma in our community, because we were told to keep everything in house, and there's so much trauma that we've experienced, but we don't know how to deal with it. And we're just now learning how to talk about it, and so. That's what I want individuals to go away with a better sense of understanding and being more comfortable to talk about it. Because if we can talk about it, then we can get treated.
All right. Well, Robert, this is so nice to have you here. I pray that everybody that listens in and watches gets a lot of information, understands, that, we really need to seek help if we need it. Know what things to look for, and please find somebody that you can talk to that you trust, like Robert here. So with that, we're going to conclude our episode here, and we thank y'all for showing up. Thanks, Robert.
Have a good weekend.
Yes, that's a wrap.